Hey everyone, you are watching and listening to CareMinds podcast. I'm your host, Daniel. It's January 2023. We decided to kick off this year with a pretty interesting and special episode. This episode, I think, is going to offer a lot of insights for product owners and product managers who want to find out about other intricate ways of product expansion and product development. And today, helping me with this is Mr. Paul Norton of Scarce Health, a very seasoned professional and expert in many domains and very interesting, nuanced thinker. So please welcome Paul. Nice to have you here. Thank you very much for finding time.
Yeah. Hey, folks, and thanks so much, Daniel.
Paul, I want to just us to start from kind of like back in the day a little bit, and just to help our audience understand your early choices with regards to your, education and early kind of like career gigs that help you shape your career path early on.
Yeah, I think if you go way back to like when I was in elementary school, both of my parents are healthcare providers.
Oh, cool.
My dad is a pediatrician. My mother is a registered dietitian. Both of them cared for and continue to care for lower income and in some cases higher risk populations. And I just kind of, heard over the dinner table about the things that got in the way from them caring for their patients and doing their jobs effectively.
Mm-hmm.
And I went to college with this sort of broad interest in public policy and social justice. And the timing, I think, was really fortuitous as I was in college as, President Obama was getting elected and the Affordable Care Act was being rolled out. And it really felt like both with my kind of personal background with my parents and what was happening in the world, that healthcare policy was the place to be and the place to make the biggest impact that I could. I think I graduated college a little bit confused about what to do with that information. I think like many people do.
Okay.
But I took an academic research position at Harvard School of Public Health. It was kind of the career center at Brandeis helped me understand the ways in which that background could really be applied. In that role, I just sort of got really deeply steeped in both sort of health system design at the highest level because I was working for an economist who kind of worked with leaders of countries on health system design across the world. As well as specifically the rollout of the Affordable Care Act, because a lot of the work that I was doing was kind of tracking that on his behalf. And so I realized that I loved this sort of content, this sort of like systemic way in which you need to kind of think about healthcare policy from end to end. But I realized that like the observation and sort of research side of that was not for me. I'm too action and execution oriented. And I had been reading, a lot of my research about the impact that technology could have on the ability of healthcare providers to take on more risk for the health and cost of their patient populations. And so that's kind of where I decided was like, I think what's really going to shape the ultimate like outcomes that policymakers want and the impact that I want to help on the healthcare system is technology. And so that motivated me to join Athena Health, which was like literally down the street from my office at Harvard and was
That's
hiring
pretty cool,
like
yeah.
crazy at the time. Yeah. And so I joined in a very technical and kind of operational role focused on building algorithms to keep claims from being denied. But as I kind of got my foot in the door there, it became really clear that they needed kind of help with product strategy and rollout related to value-based care. And having this policy background really enabled me to kind of like step into that role. And I think it's a good example of where, having a kind of like domain expertise or background in something that maybe looks a little bit different from your peers can kind of help you step into take on like higher levels of responsibility early on. So that was kind of my initial foray. I think the policy work really dovetailed nicely into having a lot of exciting kind of product focused responsibilities early on at Athena. That was kind of my introduction, and it was an amazing time to be in health tech, just the combination of the, change in the way that healthcare providers are being paid, the push from the federal government to adopt electronic health records, and the government was like literally giving physicians money to buy our product. Like, it doesn't get a whole lot better than that as far as market conditions. It was just like the company doubled in size and revenue in the 3 years I was there. It was really it was a pretty awesome time. So that was kind of my introduction. I knew I wanted to broaden my horizons. I was very curious about the West Coast startup scene. So I went out to Berkeley for my MBA and MPH. I got to work with one of, the unicorn startups, Proteus Digital Health, and it was an absolutely amazing team of people. And I think a good example of, you might be solving a big problem, but if the market isn't ready for it, and if patients don't want to like adopt the technology for a variety of reasons, and some challenges there, and we could talk about that a little bit maybe. But ultimately, when I left, I knew I wanted to join an early stage organization. I was not expecting to join a nonprofit, but I think that the challenge of health data interoperability really pushed me into that. Did a mix of everything. I did some product strategy work. I did some business development. I was lobbying in Sacramento for data sharing requirements. It was a really amazing couple of years. And then I joined Oscar for a number of different reasons. But I think the first was personal. Like, I think everybody had a big reset during COVID. And I think my kind of big revelation was that I did not like being across the country from my family, and sort of New York and the East Coast was appealing. But I think the second was that a lot of my work at Manifest Medics was with health plans. Health plans are a big funder and partner of ours to try and push data sharing across the healthcare system. And I noticed that there were many health plans that really wanted to kind of advance the healthcare system with technology and data, but didn't always have the right capabilities, both in terms of tech and in terms of kind of like internal knowledge to do that. And I think and a company like Oscar, like a tech-driven health insurer, trying to sort of like take that those capabilities and bring them to more of the healthcare system and more of the healthcare plan, more health plans and other healthcare organizations, really excited me for that reason. And so that was kind of how I ultimately stepped into that role. And I've been at Oscar now for a little bit over a year and a half.
Yeah. We're definitely going to touch base about Oscar Health in a greater detail. I just wanted to summarize in the retrospect. Have you been thinking what kind of qualities, maybe expertise to a certain degree, helped you landing these, initial kind of gigs at Athena Health, for instance?
Yeah. I mean, in all cases, people, and I think in different types of, connections. One was actually, through a former boyfriend of mine, was the connection at Athena. At Manifest Medics, I met the CEO through a sort of mentor, someone who I'd worked on some independent consulting with. And then at Oscar, it was a friend from business school who had kind of who had referred me and helped me there. And so I think, for me, it's a lesson of the connections, and people can come from all types of different places. Like Proteus, I literally learned about somebody in front of me in a security line at the San Francisco airport had a backpack with a Proteus Digital Health brand. And I was like, I haven't heard of this company. I wonder what they are. And Googled them, and then found a second degree connection on LinkedIn and got an intro, and the rest, that was that. So I think, never underestimate where you might be able to find a lead. It could happen at 5 a.m. in an airport line. You might discover a new company. You never know. So I think that's the first lesson. And yeah, I mean, I think the second is that it can be really easy sometimes to feel like you have to check a certain set of boxes or fit a really specific profile to land a job that excites you, to be competitive in the market. And I have felt that way at times, definitely, when I'm sort of looking for new roles. And I have kind of realized now that I'm a little bit further into my career that actually can be a really great differentiator and set you up for really like interesting and unique opportunities. And so I would also encourage people who, maybe are newer to tech or to product management, or sort of thinking about entering from like a different industry or functional area, to kind of think about ways that their background can help in, doing a product job effectively, and do so in a way that is like differentiated.
Gotcha. All right. Thank you very much for that input, for the points. Oscar Health is a pretty interesting company and grew quite quickly due to their kind of like extensive tech capabilities and sort of like leveraging these abilities to enhance further partnerships with different healthcare providers. So we've talked about your motivations to join Oscar Health. What I found quite fascinating in the way that we've touched base about it is that you occupy a pretty interesting position there, something that is pretty hard to find and very unique to Oscar Health itself. Can you describe a little bit what it is?
Sure. So I, at my formal title, Associate Director of Product Solutions. Product Solutions is specifically focused on delivering on the technical needs of our Plus Oscar partners and clients, and also ensuring that kind of internally within our tech organization, we're well set up to kind of service B2B clients in a way that is effective and sustainable. And so given that Oscar's sort of presence as in partnering with other healthcare organizations is relatively new, there's a lot that we're kind of figuring out as we go along. But I think I was really excited about that fact when I joined, of sort of being really the first kind of full-time member of the product team with that focus.
Got it. And for some people that could not necessarily know what Plus Oscar is, can you just briefly touch base on that?
Yeah, it's a little bit of an umbrella term that has evolved, but it's essentially, the way that we are externalizing our technology for the use of other health plans. And so it has kind of taken a few different forms, starting with our Cigna plus Oscar partnership. And that's really like a joint health plan offering between us and Cigna, where we're like, it's a joint health plan offering. The two organizations share in the risk for those patients. We're using Cigna's network, but much of Oscar's technology. And so that's kind of one version. And a lot of my role is kind of collaborating with Cigna on their sort of technical needs. We at a certain point had sort of full stack. We're going to market with full stack, a full stack platform. And I think that that's something that's worked really well with Oscar, right? Where you have like end to end the same data used to process claims is surfaced in our member application, and sort of it's a big integrated platform. I think we realized at least that in the current market conditions, asking a healthcare organization to, rip out their entire infrastructure essentially and replace it is a huge undertaking. Yeah. And what the market really was looking for was more modular offerings. And so we kind of announced at the beginning of this year that we were moving towards a more modularized tech strategy and going to market initially with one of our member engagement tools called Campaign Builder that sort of enables member outreach for various kind of patient engagement activities. And so another part of my role is kind of focusing on figuring out like how we bring that to market and sort of stand up those partnerships. So kind of a long-winded answer, because I think the definition has evolved as we've gone to market and learned. And I think it'll be a definition that in some ways continues to evolve as we, hopefully roll out like more elements of our stack, kind of learn more and get more feedback from the market. But yeah, right now it's been sort of a mix of those things, but really focused on in part this partnership that we have with Cigna offering a joint plan, and then this sort of more modular offering around patient engagement, member engagement, I should say.
And I think this directly connects to the point, the one that you touched base with me earlier on, is that Oscar Health is striving to sort of like enhance user experience, right? That you typically would not sort of like get from an insurance company.
Excuse me.
Yeah.
Yeah, absolutely. I mean, I think that that's been sort of like a core differentiation point and key part of the mission statement from the very beginning of the company. It's something, I think one kind of fun thing when I started, we did have like the ability to enroll in an Oscar plan as an employee. And I think like actually getting to experience that firsthand was pretty remarkable. And I think that the way in which we sort of have that fully integrated tech stack enables that, because we're not having to sort of move data around between different systems and kind of like piece things together. It all sort of like layers on top of things, and it gives us a lot more flexibility with how we sort of surface data to members and providers, and what we do with that information, and how we sort of change things on top of that. And so, yeah, it's I think differentiated in the market. And I think that we've, realized that, of course, we want to enroll more members in our respective plans, but there's also a huge opportunity to make that technology power more of the healthcare system by partnering with other healthcare organizations that might be in markets that we're not in, that might in some cases be, potentially provider groups, like things like that. So I think, there's just an exciting opportunity in that regard.
Yeah. Paul, you've noted that you've been at the kind of like intersection between like healthcare, technology, regulations. Would you also say that you include kind of like the novelty into that? Because the last point that you've just touched base on is that Oscar Health is trying to, navigate through new opportunities, right? What are some of the things that you're currently working on at Oscar Health that you could share with us?
I think I would say when it comes to sort of regulations, that in many industries, regulation is perceived as a blocker to progress and to technological innovation. And I think that oftentimes, both healthcare enterprises, health plans, providers, and in some cases, health tech companies kind of point to regulation as a blocker of progress, and frankly, in my opinion, like use it as an excuse. I think that we often underestimate the ways in which policy and regulatory change create opportunities. And so, when you look at, for example, like legislation that I kind of helped to eventually get passed in California around requiring the sharing of data between health providers and health plans, like that creates opportunity for technology organizations that facilitate that, right? When you look at some of the transparency and coverage and interoperability requirements, like that requires technical infrastructure to, surface your, data on rates and out-of-network claims, like in a way that's machine readable, or to store member data for like in an API, so that like they can download that in an app of their choice if they are interested. Like all of these, I think, new requirements around sharing data and things like that, like in transparency and how we are paying for coverage and things like that, I think also create opportunity. And I would say in the context of like Oscar, our ability to kind of not just keep up with these regulations, but also kind of like use them as a way to enhance our existing member experience like offerings, I think in some ways, it's challenging, but it's also exciting.
Got it. And had you like observing this situation where some companies have these regulations sort of like as an excuse to not do, right? Have you observed what sort of like maybe thinking or behavior or anything that you could possibly attribute to a company going about the regulations the right way and enhancing their business capabilities, and going the wrong way and doing the opposite?
Um, I think in terms of using them as an excuse, this is less on the tech side and more I think any person that has gone to the doctor in the US has been told that they cannot access some element of their, whether it's their own health information about payment to a provider, you name it. The number of times that HIPAA has been incorrectly used as a reason to not share the data like with the person whose data it is just like remarkable to me. And the number of times that I have like gone to a doctor and been told like, sorry, we can't give you that. And I of course checked them on it because I literally wrote and commented on data sharing policies for a living at one point, but for people that have not had that opportunity, they might not necessarily know. And so I would just kind of say that for our listeners in the US who are told that information, you have many opportunities to push back on that. So I would say that's one thing. When I look back at kind of, where can we use policy as a differentiator, I think a really great example of that. My team at Athena Health, I was on a team called quality performance and value-based care. And during my time there, the government, CMS had rolled out a couple of really big programs. One was around meaningful use. The other was called the PQRS, Physician Quality Reporting System. That's all rolled up into this in kind of MACRA was a law that the government passed that kind of evolved these programs. And so the nomenclature's changed a little bit. The performance metrics have changed. I think the way that the company approaches, I imagine, is pretty similar. But like at Athena, what we said is like, we have a cloud-based platform that gives us visibility into the way that our clients are using our tools across the board. And at the time, relative to many other kind of more like software-based EHRs, that was a differentiator, that kind of visibility. And so we actually had a team of people that could keep our providers on track to successfully report PQRS, successfully report meaningful use. And what we kind of were able to do was say like, this like differentiating capability enables you to perform better in this policy environment. And so I think that like when you look at like your kind of tech capabilities, it thinks about like what is differentiating about like your offering and how does that differentiation become stronger when the policy environment which is essentially like a market condition changes. And I think that's something that a lot of like product managers, product leaders have experience in when it comes to sort of where does my product kind of fit in and differentiate when market conditions change. I think that where there's like a real opportunity is to, connect the dots really clearly between like the policy change and the market conditions. And I think that's something where, a lot of folks are like, I don't want to read these really long requirements and, can someone kind of translate that? And I think there's, if making that connection sort of upstream from policy change to market condition, I think is where there's, a really big opportunity.
I definitely think that any product ownership would massively, especially in the healthcare domain, would massively benefit from a person like you that knows these kind of like policies and could also navigate product owners and product managers in a way and communicate with them in the way that they understand. In your particular experience, what was your kind of like typical, I guess, interactions with product managers of, let's say, different subdivisions of a product that are working on a subset of different products within like one company?
Yeah, so I think I can start with my time at Athena. I'll talk a little bit about Manifest Medics, and I'll talk
Sure.
about Oscar since
Go ahead. Yeah.
it sort of looked different. At Athena, like I played that policy translation role. And so my job was to kind of help the leaders across our product organization understand, for whether it was clinical documentation, whether it was billing. Now that there's this new opportunity, like what opportunity does this create and what like threat does this create? And sort of looking at things like, okay, providers are getting paid based on the cost and health outcomes of their population. One implication is that capturing the full picture of the patient's health and getting like diagnosis codes on claims is a huge deal, right? So in a way that it wasn't in just fee for service. And so then it's saying, what does that mean in terms of clinical documentation? What does it mean in terms of billing? And sort of, I think having a good kind of process understanding of what that looks like between the physician's office and kind of billing, I think is the first step. And then from there, you can then kind of go to different owners and product leaders and help them understand, what is the big sort of opportunity or threat that's created. And I think that was a similar process for risk adjustment. Providers had an opportunity to bill for non-face-to-face chronic care management. That was rolled out, in 2015, and then sort of helping understand, well, number one, like what do we actually have to do to enable that? And there were some pretty kind of complicated requirements from CMS, and then like what are the implications from a sort of process and workflow standpoint. And so I think it was really, what I hear a lot from the PMs at Oscar is like, give us good, like clear requirements, right? And I think that a 1,000-page like final regulation document where you have to sift through like just comment after comment and response is like pretty much the opposite of that. And so I was kind of the like person that translated that into business requirements and could kind of provide the context there. I'd say at Manifest Medics, it looked a little bit different. And so again, I kind of came in as sort of just strategic initiatives lead, like doing a little bit of everything, kind of right-hand person to the CEO type role. And a big part of that, health information exchanges are nonprofits. They were stood up through government funding, basically with like an idea of we need to share data. And I think everybody agrees with that. But the challenge, I think, is that turning that into a clear like user story and value proposition for all of the different stakeholders across the healthcare system is much more complicated. And, sometimes it's like, okay, well, we know that sending a record from one patient to one provider to another for a given patient is like a good thing, but we need to get really crisp on who that helps at this provider's office and when and how. And so It was a lot of really like almost kind of product marketing, but really like boiling down the use cases and value propositions and user stories in a way that was really rigorous. And I think because of the, nature of how these organizations started, like they weren't having to, go pitch to VCs or things like that. Like they were kind of built with this intention of scale, like to start, and then you really have to get crisp on those like definitions and value propositions. And so that was really the case there. At Oscar, I really have interacted with every pod, across all of the different domains to kind of support some of these partnerships that are really extensive in that like end-to-end technological support. And that's been really fun. I think, I am learning something new every day as far as the domain. And I think that the role that I kind of played there, and some consistency across the board is that like translator of requirements, right? And so helping the team understand like where this, what is a client, if they're asking for something, like really looking for, how high of a priority is it really, what are some feasible and viable alternatives, and sort of playing that role of translation between like an external client or organization or client facing team and our product team to kind of help really shape what that priority is. And I think, to be quite honest, like there are elements of that have been that are challenging because the coverage of domains is so wide that like I have to kind of like learn something new, with every pod, and we've got like 15 pods or something across the board. And so I think that kind of constant learning of like new domains has been like a really fun and new challenge in playing that role.
For all of our business
kind of
analysts.
a long answer. Sorry.
Yeah. No, it's good. It's very extensive for all of our business analysts who are listening and want to like 10x their exposure to ambiguity. I think this is kind of like the right path,
Yes, there's been a lot of that throughout my time, and I think that's the fun part.
Awesome. I was wondering about your kind of like personal takes, like given your pretty interesting way and unconditional way getting into product ownership and product managers. What would you say are the kind of like core skills and kind of like initial mindset that could bring value into a company if you're just starting out?
Yeah, I would say there's like 3 key characteristics: curiosity, skepticism, and empathy.
Why
Curiosity is
skepticism?
like pretty obvious.
Yeah.
Why skepticism?
Yeah.
Because PMs have to say no all the time, right? Like everybody is going to have a million ideas. And in many cases, people kind of come to you with a particular solution in mind without kind of really understanding the motivation and root cause behind that solution. And in many cases, there are a lot of alternatives to kind of getting to the same place. And yeah, you have, so, everybody wants to kind of, you have limited resources at your disposal, and you have, many requests from a wide variety of different stakeholders, and just sort of vet and prioritize and understand the motivation behind them. I think that requires like a very significant degree of skepticism because of how often you have to say no. So,
and to that point, I think to that point, I would also add that you need to have a good skill of working with data, because how else you're going to evaluate if one request has more priority over the other one and has actually more value to the end product and the customer, right?
Yeah, I think any good product organization uses data, of course, to drive those decisions. I also think that figuring out how to make those prioritization calls in the absence of good data is equally important.
Yeah.
Because, like, for example, a client request, right? Like you have no data necessarily around like what you might have data to back that up, but you might not to necessarily understand how much they care about it. And I think there's some reading between the lines to do that. And, if you're entering into like a new vertical or a new market where you might have external data to help you understand a business case, but you don't necessarily have like data that from, your own products and systems. And so I think one of the first questions I got in my first interview, like round of interviews at Oscar, was, have you ever had to make a business case or vet a business case for something where there wasn't a clear ROI, and how did you do that? And I think that like when I had a really clear answer, because that was what I was doing every day at Manifest Medics, which is like, I'm trying to get the state of California to spend tens, hundreds of millions of dollars to stand up a statewide healthcare data network and pass laws requiring that. And, there's some research on, and some data on the sort of impact that data sharing can have, but it's not great. And it's really just a matter of sort of, making a really clear qualitative case, or these are all of the ways in which this can generate like value in the healthcare system and make it work more efficiently. And so I think, yeah, being data driven is super important. And I think that like, any good and skeptical like PM has that skill set, but I think that, really figuring out how to make those prioritization calls in the absence of good data, and having, good ways of storytelling, of kind of vetting in a way that is qualitative and structured is equally important.
And you also mentioned empathy, right?
Yeah.
Why do you think it's also, a cornerstone?
Yeah, I think so. Yeah, I think empathy, just having a really good understanding of the needs of your users and sort of being able to feel like the impact that an experience, good or bad, has on them, I think is super important. And kind of being able to put yourself in those shoes. I think if you can't do that and get that really clear understanding of your user, it's going to be really hard to design for that person and meet their needs. And I would say that it's empathy for like all of your different stakeholders. So I think there's a lot of emphasis on sort of like the user, and I think that's really important. But I think especially in like a B2B space, or even when you just have like internal stakeholders that are not necessarily end users, to be able to understand like their needs and their perspective as well, and kind of put yourself in their shoes. And that, I think that's a really good example of a kind of, qualitative data point that maybe that can help you make decisions and prioritize, is to get a really clear understanding of the way that, whether it's an executive in an external healthcare organization, or like an operations leader, like internally, or a provider, or like whoever it is, to be able to really understand like how much pain is this going to cause them, and like how, and from there, that can really shape, the way that you design, the way that you prioritize, and all of those things.
Gotcha. And what are the kind of like habits that make a great productive product owner / manager, in your particular opinion? We can just boil it down to just the top 3.
Great habits. Oh man. I don't necessarily know if I have like a good answer to that question, because I think it's so individual. I think there's one habit, and I think it's find what works for you. Some people might, that's what I would say. I don't have a whole lot beyond that, because I think it's super individual, and I think that find what works for you could be as simple as like, I'm going to make time to work out every morning to kind of make sure that my head is clear. Or it could be, I'm going to read this like newsletter every week to keep up with industry trends. Like, I think that if you ask 100 different people, you're going to get 100 different answers. And it's about finding like the balance that works for you.
And what works for you?
Because I said it, kind of the workout every morning and kind of clearing your head, I think is super important. I was a college cross country runner. I was running 90 miles a week. One thing I learned is that you get to a certain point where like working harder makes you worse. Because you burn out and you get injured and you get sick and like all of that. And my, personal opinion is that much of that principle can be applied to our minds. And I think that especially in a role that requires like, creative and strategic and technical thinking and like going in a lot of depth, just knowing like when you are starting to get diminishing returns on your efforts and finding a way to reset. And I think that can be like big or small. But for me, like prioritizing my health, which I think especially if you're working in healthcare tech, like you've got to walk the walk to some extent, so prioritizing my health and kind of both physically and mentally, I think that's been, that's my number one habit. And I think that if you do that, then all of the other stuff kind of trickles down. You communicate better, you think better, I think you can do it's the number one kind of like performance answer for everything else. So I think if I had one tip, it would be to like take care of your body and mind.
Awesome. Good stuff. I was also fascinated with, your ability to kind of like help a company to shift their business model from B2C to B2B.
Yeah.
What is it that I think helps you make that transition for a company? How do you go about this?
Yeah. I think that there's kind of going back to like what makes good PM. I think there's some like two things, and I would say the first kind of related to the empathy piece, right, is that you have a new stakeholder type, which is this like external sort of leader executive that has like a certain set of priorities and things they're worried about and all of that. And I think that one thing is sort of helping folks in our technology organization kind of have that like empathy and put themselves in the shoes of those like particular folks and sort of thinking of them as a new stakeholder and user and kind of the ability to put themselves like in those shoes. I think that's one big piece, is kind of really being able to help think from that organization's perspective, which like when you've had all of your stakeholders are internal is just like a new thing. So I think one is the kind of mindset piece that's, a little mushier, kind of right brained. I would say the like left brain side is really about setting up really good frameworks and processes around like prioritization, sort of expectation setting with clients and things like that. And kind of doing a lot of work to sort of codify what those processes are when new sort of like requests or issues come in. And so I think there's the like mushy right brain side of like, who's this new person that we need to like empathize with and sort of understand the needs of. And I think there's the kind of more structured side of, we need to kind of codify a lot of things to effectively set expectations and prioritize kind of the right way. And it's been a mix of really those two things.
Got it. And what in your way are, what do you think about like, making yourself a Scarce specialist in the ever-changing environment where things changing constantly and rapidly? What are the things that you typically suggest and give advice to people about like making yourself such a Scarce specialist that is always resilient?
Yeah, I think it kind of goes back to my like original point about just finding the things that make you different and really leaning into them. Mm-hmm. So for me, the fact that my parents were healthcare providers meant that I, had a perspective on a given stakeholder and user that was really intimate and kind of went beyond that. And that was something I leaned into. The fact that I was well-versed in policy meant that at Athena, I was sort of like jumping up and down to kind of get opportunities to flex that. And like even during my time at Oscar, I sometimes sort of will help a little bit with work on the interoperability requirements, not necessarily because it's like directly in my scope of work, but it's because I know something about it. I think it's just, and in my time at Manifest MedX in the nonprofit space, like I was coming directly out of business school with, I think, a really, a sort of private sector mindset, if you will, of like, we really need to prove out our value proposition, our market positioning, and all of these things that, had not always been directly top of mind in a nonprofit as well. And so I think it's about like, in any given environment, find what makes you different and really lean into it. And, in my time at Oscar, that's of course been the sort of B2B background that, I was brought on for. And I think that's the first piece. And I think, the second is to be confident in the value of that difference. And I remember, when I was had started like a couple months in at my time at Oscar, and I was just like I really had a pretty strong sense of imposter syndrome, right? Of like kind of playing in this more like lead role that I hadn't had before. And,
Mm-hmm.
I'd never even been a product manager, let alone like any sort of like product lead. And all of a sudden I was kind of in this role, like expected to lead. And our chief product officer at the time, I was kind of talking to her about like, how do you think about like ways to overcome that? And what she said was remarkably simple, which is just like, if you were not the right person for this role, like somebody else would be in it and they're not. And I think to just like remind yourself of that, like on a daily basis is really like important. And I think, there's a lot of things around kind of like confidence that are much more complicated than that. But I think just the simplicity of that statement and just the extremely factual nature of it really appealed to me.
Yeah, couldn't agree more. And yeah, I think your last take would be about, the things that, for instance, a product manager, product owner could expect at a bigger company transitioning from, let's say, Series D startup. And I think in your particular background, you can definitely talk about this because you've been in both contexts. You've been in a startup environment and you've been working in a big company and now in Oscar Health. So, yeah.
Yeah, I would say like the so going from smaller to bigger, and I'll just caveat this saying that the small organization I worked at was a nonprofit where like we were working with a lot of like external partners on rolling out tech, and so I think it probably looks very different than like a venture backed sort of pure tech startup.
Mm-hmm.
That said, where I think the sort of the big challenge going from small to big, in my opinion, is that you have way more competing priorities and stakeholders to manage, right? Like big companies are just doing more. There's, more potential things that you could do. And I think the challenge there is really prioritization and stakeholder management and all of that. Like, I think there's just way more to sort of sift through to kind of figure out the right direction. And I think at a smaller organization, prioritization is still a challenge because the resources are scarce, but because there are kind of fewer stakeholders and decision makers, getting to that consensus becomes much more straightforward. So that's the kind of, I think, the challenging piece. I think on the plus side, you just have so much more, you have all these like people around you that you can learn from. And so, my time at Manifest Medics, I think, smaller team and obviously wonderful mentors, but there are many cases in which like, I was kind of turning to like external sources to learn about like things like product marketing and things like that. Whereas at Oscar, like, having this team of like incredibly seasoned product folks around me, I'm kind of able to really, learn from them directly and things like that. And so I'd say that's the sort of mix and expectation I would think about. And that's what I would say.
Perfect. And like a bonus one, things that you're excited about in 2023, like future plans that you're sort of like trying to implement with Oscar Health, or anything that kind of like excites you and moves you forward as a professional.
Yeah, I would say two things I'm excited about. I'll start with, at Oscar, like I think that this modularized kind of offering around member engagement, sort of seeing where that goes. I'm excited about that. And just sort of this is the big like year for us to kind of focus on our insurance company profitability. And I think that we've been sort of like disciplined in getting to a point where we're well set up for that. And so I think those are the two things I'm excited about at Oscar. I think that like outside of Oscar, one thing that I'm strangely excited about is like the current investment climate for health tech. And I think that sounds like a weird thing to say because, 2020, 2021, there was so much money coming in. And the reason I'm excited about, I'm not excited about the fact that there's less money to go around, of course, but what I am excited about is I think the way that that's going to produce startups that are really that are really resilient, that are really driving towards sort of key, clear value propositions, and that are going to be really disciplined. Because, I think that when you have a ton of money that goes into something, uh, and I
Everything
think
grows. Yeah.
kind of
Everything
without,
grows.
yeah, I think that sometimes, there's going to be a mixed bag of things that come out. And I think when you look at kind of back in the financial crisis of 2008, 2009, I'm forgetting the companies off the top of my head, but some of the biggest tech companies out there were founded during that period because they had a value proposition that was clear enough to sort of weather that storm. And so I think that the companies that are starting right now are ones to really watch because they are clearing a really high bar in terms of the belief that investors have in their ability to be successful, and they have a degree of confidence there. And so I think it's really easy to be discouraged about the current investment climate, and I just kind of want to say that to sort of highlight the fact that there's actually, for the folks that are in it, there's something to really be encouraged by, because that success is just that much more meaningful, and there's a track record of companies kind of being set up during these types of times and ultimately being really successful.
Yeah, I think it's the best definition. I think in Chinese, crisis also means opportunity. So,
I didn't know that. Yeah, learn something new every day.
yeah, expecting a very tremendous shift in healthcare, hopefully in a good way. Thank you, Paul. It was a pleasure talking to you. Paul is open for business networkship, so please visit his LinkedIn page. If you're excited about Oscar Health and wanted to join for a long time, please visit Oscar Health at their website, their career page, to guide you further. Yeah, Paul, thank you very much. It was a pleasure to have you here. It's been Daniel, and you've been listening to CareMinds podcast. Please like, share, and subscribe if you like this episode, and we would be also excited to see in the comment section if this type of content is something that you want to hear more. And thank you. Signing off. Cheers.
Thanks so much.